Age-related macular degeneration, or AMD, is a common eye disease that primarily affects older adults. It specifically targets the macula, which is the central part of the retina, crucial for our vision. The retina is the light-sensitive tissue at the back of the eye that captures visual information and sends it to the brain. The macula is responsible for sharp central vision, which is essential for tasks requiring detailed sight. This type of vision is what we use for activities like reading books, driving cars, and recognizing faces. AMD typically affects older adults, usually those over the age of 50. It's a leading cause of vision loss in this age group, significantly impacting their quality of life. While AMD doesn't cause complete blindness, it can severely impair the ability to see fine details. This makes everyday tasks like reading small print or recognizing faces challenging. There are two main types of AMD, dry and wet. Each type affects the eye differently. Dry AMD is the more common form, accounting for about 80-90% of cases. It occurs when the macula gradually thins over time, leading to a slow progression of vision loss. Wet AMD is less common but more severe. It happens when abnormal blood vessels grow under the macula, leading to rapid and severe vision loss. AMD is a serious eye condition that requires medical attention. However, early detection and appropriate treatment can help slow its progression and preserve vision, allowing individuals to maintain their independence and quality of life. Dry AMD is the most common type of AMD. About 80% of people with AMD have this type. Dry AMD happens gradually over time. It starts with the breakdown of cells in the macula. These cells are called photoreceptors. They are responsible for converting light into electrical signals that the brain interprets as vision. As dry AMD progresses, the photoreceptors in the macula become damaged and die. This leads to blurry patches in your central vision. You may have difficulty reading or recognizing faces. There's no cure for dry AMD. However, there are things you can do to slow its progression. These include eating a healthy diet, exercising regularly, and not smoking. Wet AMD is a more serious form of AMD. It happens when abnormal blood vessels grow under the macula. These blood vessels are fragile and can leak fluid or blood. This can damage the macula and cause rapid vision loss. Wet AMD can cause straight lines to appear wavy. You may also see a blind spot in your central vision. Wet AMD can progress quickly. It's important to see an eye doctor right away if you notice any symptoms. There are several risk factors for AMD. Some you can control and some you can't. The biggest risk factor is age. AMD is most common in people over 50. Family history is another risk factor. If you have a parent or sibling with AMD, you're more likely to develop it. Smoking is a major risk factor for AMD. It damages blood vessels in the eye and increases your risk of developing the disease. Other risk factors include obesity, high blood pressure, high cholesterol, and excessive sun exposure. Recognizing the symptoms of AMD. Age-related macular degeneration, or AMD, often develops gradually over time. In the early stages, you may not notice any symptoms at all. This can make it difficult to detect without regular eye exams. However, as AMD progresses, you may start to experience noticeable changes in your vision. One of the first symptoms is blurry central vision. This blurriness can make it difficult to see fine details such as letters in a book or numbers on a clock. You may also find it challenging to read. Even with glasses, reading can become a strenuous task. You might need to use a magnifying glass or other aids to see clearly. Another common symptom is the appearance of dark spots in your central vision. These spots may start small, but they can grow larger and more obstructive over time. Additionally, you may notice that straight lines appear wavy. This distortion can make everyday tasks like reading or recognizing faces more difficult. Straight lines, such as those on a grid, may appear wavy or bent. If you experience any of these symptoms, it is important to see an eye doctor right away. Early detection can make a significant difference. Early detection and treatment of AMD are crucial for preserving your vision. Regular eye exams and prompt attention to any changes in your vision can help manage the condition effectively. Diagnosing AMD, early detection is key. Early detection of AMD is essential for preserving your vision. Your eye doctor can diagnose AMD through a comprehensive eye exam. This exam will include a visual acuity test, which measures how clearly you can see at different distances. Then there's the dilated eye exam. Your doctor will dilate your pupils with eye drops to get a better view of the back of your eye. Next, an Amsler grid test uses a grid of straight lines to check for distortions in your central vision. Finally, fluorescent angiography uses a special dye to highlight the blood vessels in the back of your eye. Treatment options for AMD: slowing down vision loss. There is no cure for AMD. However, there are treatments that can help slow its progression and preserve your vision. Treatment for AMD depends on the type you have, dry or wet. For dry AMD, there is no treatment to reverse the damage. However, your doctor may recommend taking high-dose antioxidant vitamins and minerals. These supplements may help slow the progression of dry AMD in some people. Treatment for wet AMD aims to stop the leakage from abnormal blood vessels. This can be done with anti-VEGF injections, which block the growth of new blood vessels, or laser therapy, a procedure that uses a laser to destroy abnormal blood vessels. The importance of prevention. Protecting your sight. While you can't control all risk factors for AMD, there are things you can do to protect your vision. These include getting regular eye exams. Everyone over 50 should have a comprehensive eye exam at least once a year. Don't smoke, as smoking damages blood vessels throughout the body, including the eyes. Eat a healthy diet rich in fruits, vegetables, and omega-3 fatty acids, which may help reduce your risk of AMD. Maintain a healthy weight. Since obesity is a risk factor for many health problems, including AMD, and protect your eyes from the sun by wearing sunglasses and a hat when outdoors. Living with AMD, tips for maintaining your independence. Living with age-related macular degeneration, or AMD, can be a daunting experience, but there are ways to manage it effectively. Living with AMD can be challenging, as it affects your central vision, making everyday tasks more difficult. However, there are things you can do to maintain your independence and quality of life. With the right strategies and tools, you can continue to enjoy your daily activities. Use low vision aids like magnifying glasses, large print books, and talking watches to help you see and read better. These tools can make a significant difference in your ability to perform tasks independently. Make your home safer by improving lighting, removing tripping hazards, and installing grab bars in the bathroom. A well-lit and organized home can prevent accidents and make moving around easier. Stay active and engaged by exercising regularly, participating in social activities, and pursuing your hobbies. Physical activity and social interaction are crucial for your overall well-being. And seek support. Talk to your doctor, family, and friends about your condition. Open communication can help you get the support you need. Remember, you're not alone in this journey. Millions of people around the world are living with AMD. Joining a support group can provide you with valuable resources and a sense of community. With the right care and support, you can continue to live a full and rewarding life. Embrace the help available to you and focus on the positive aspects of your life.